Hi, I'm Dr. Jay Hall. In this video, we're going to review the application of distortion product otoacoustic emissions, or DPOAEs, in hearing screening of preschool and school-aged children. I'll talk specifically about hearing screening with the GSI Corti OAE device. Otoacoustic emissions are a popular and evidence-based technique for newborn hearing screening because they are objective. The patient does not have to respond to the stimulus, and the evaluation will tell the tester if the hair cells in the ear are working properly. DPOAEs also offer at least 5 advantages as a technique for hearing screening of preschool and school-aged children. First, DPOAEs are extremely sensitive to the most common types of cochlear dysfunction involving the delicate outer hair cells. Second, a DPOAE refer outcome is also typical in children with middle ear disorders due to ear infections. Third, DPOAEs can be recorded from almost every child, including very young or immature children who cannot be tested with the pure tone technique. Fourth, hearing screening with DPOAEs is very quick, usually taking less than 30 seconds per ear. Finally, the DPOAE technique is entirely objective. The child doesn't need to listen to or pay attention to the stimuli, and the DPOAE device automatically determines whether the screening outcome is a pass or a refer. Research in recent years confirms that an appropriate DPOAE screening protocol detects hearing loss in the same children that would be detected with the traditional pure tone screening technique. DPOAE screening will also pick up some children with auditory problems that would be missed with the pure tone hearing screening technique. And importantly, DPOAE screening can be performed on children who cannot be tested with the pure tone technique. When you first arrive at the screening venue, put the GSI Corti device into the charging cradle and be sure there's adequate battery power. Take a close look at the end of the probe and make sure the tiny tubes or ports are all clear. Also, be sure you have a good supply of different sizes and colors of clean silicone ear tips. There are a few steps for you to take before performing DPOA hearing screening on each child. Take a moment to inspect the child's outer ear and ear canal. With a smile on your face, mention to the child that you need to take a quick look at each of their ears. Make note of anything unusual or unexpected, such as growths, evidence of injury, atypical shape or position of the outer ear, small pits in the skin or skin tags in front of the ear. And also, before inserting the DPOE probe, it's important for you to inspect the ear canal for any evidence of debris, earwax, or foreign objects. Make note of the size of the ear canal opening and think about the color of the silicone tip you want to use on the probe of the DPOE device. Select an ear tip that is the appropriate size for the child's ear canal opening. Typically, the small blue, yellow, or green ear tips accommodate most ear canals of children aged 3 to 7 years. It's okay for you to try more than one size before you are able to obtain a tight fit. Slide the ear tip as far as possible on the DPOAE probe. You'll use the same ear tip for both ears. You can also use the same ear tip when you perform tympanometry, immediately after DPOAE screening. Instructing children about DPOAE screening is quite simple. You just need to pleasantly tell children that you'll be checking out how their ears are working. The child doesn't need to listen for any sounds or tell you if they hear a sound. They just need to sit quietly for a short time. For this evaluation, you'll perform the DPOAE screening for the right ear and then the left ear. To perform the test, the ear tip on the probe of the GSI Corti device must be inserted firmly into the child's ear canal. The probe fit should be secure enough that it stays in the ear without having to hold it in place. After you insert the probe tip into the ear, you'll press the R button to start the test for the right ear and the L button to start the test for the left ear. When a test is started, you will see a probe check on the display screen. The white vertical line represents the probe, and the cone shape represents the ear canal. If the white line is in the small yellow area of the cone, the probe is blocked. It should be removed, evaluated for debris, and replaced into the ear canal. If the white line is in the large blue area of the cone, there is not a proper seal, and the probe should be adjusted to ensure a tight fit. At this time, you may need to change the ear tip to a larger size. When the white marker is in the middle of the cone and a stable fit is detected, testing will begin automatically. During testing, you will see some bars appear on the display screen of the DPOAE device. These are the results for each test frequency. The device automatically analyzes the child's DPOAEs and determines whether the screening result is a pass or a refer. There are two criteria for a pass outcome. First, the amplitude of the DPs at each of the 4 test frequencies must be at least 6 dB above the noise floor. In addition, the DP amplitude at each of the 4 test frequencies must be greater than 0 dB SPL. A pass or refer message will appear on the display screen of the Corti device when screening is complete. The device automatically stores the DPOAE screening results for each ear. There are different options for printing or storing DPOAE data. Also, as many as 500 tests can be stored on the Corti device. I would like to point out that the recommended hearing screening protocol for children under the age of 7 years includes DPOAE hearing screening plus tympanometry. Research clearly confirmed that a combination of DPOAE and tympanometry was the best option for detection of hearing loss in young children. Combining tympanometry with DPOAE measurement results in detection of hearing problems associated with middle ear disorders, as well as permanent sensory hearing loss. Children with middle ear disorders account for most of the refer results in a hearing screening program, particularly for preschool and young school-age children. Here's a handy tip. Before DPOAE screening, take a moment to inspect the openings in the probe tube on the end of the probe to make sure they're free of debris and not blocked. The Corti device comes with a probe tube removal tool and extra probe tubes so that you can easily remove and discard the dirty tube and replace it with a new one. You can also run a quick DPOAE test on one of your own ears before screening children to be sure there's no problem with the probe. Another tip: if you have a student's ear that cannot pass the probe check, ask him if he has tubes in his ears, or confirm this with tympanometry. If there's a student with tubes, the probe check can be bypassed by pressing and holding the start button, R or L, for 3 seconds. When the button is released, an in-ear sound calibration will occur and the test will begin. We just discussed how to perform successful DPOAE testing for your screening program. There are a number of additional resources available to help you learn more about DPOAE techniques, their use, and their interpretation. I would encourage you to take a deeper dive by reviewing the equipment tutorial videos available with this video.